Good evening all. Welcome to Swadhyaya, the academic section. Swadhyaya is a new venture to support academics for UGs as well as PG first year. And we are intended to provide classes as per syllabus, along with syllabus-wise printed notes, question paper discussion, relevant research paper discussion, as well as the recorded classes along with PPT will be shared to the attendees. And we will provide an academic support till the end of your exams. We have total net 25 classes and per week, one class in each subject. That is Sunday, we have Prasudi Tantra and Sri Yoga, Monday Panchakarma, Tuesday Kaya Chikitsa, Wednesday Research Methodology and Medical Statistics, Thursday Shalya Tantra, Friday Dasashastra and Vaisheshya Kalpana, and Saturday Shalakya Tantra. And this is our academic schedule. And the first two classes are free promo classes and it's completely free session. And those who are interested for further details can contact Dr. Jasur from Ayurvedamap. And the link as well as the number will be provided in the chat box. And we can move on to today's session. Introduction to Research Methodology and General Guidelines. It's being taken by Dr. Surej Subhash. He's an assistant professor of PNM Ayurveda College. Sir, we welcome you to today's session. And sir, you can start now. Thank you.
Thank you, Dr. Anjana, for the introduction. Hello all, good evening. It is quite difficult to carry out or at this present situation given the pandemic to attend classes, and everybody has shifted to the online media. So I take this opportunity to congratulate and appreciate the Ayurvedamap organization for conducting such a wonderful session for the students who are in need of the education. Okay, so without taking much time, let me enter into my topic. So today we'll be going through introduction to research methodology and the basic guidelines, what a person needs to do. So this is research methodology, as you know, it's a subject which is there for the exam, as well as it is a part of your thesis work as well. You need to be actually getting involved into the research activities. So the presentation will be taking both the aspects, like the theoretical as well as the application level aspect of research methodology. As you can see, we'll be covering these topics today. It is as per given in the slides. So we'll be going through the definition of research and Anusandhana, as well as a broad scope of research, the dimensions of health research, and the need of research in Ayurveda. How do we select a research problem and how can we formulate a research question? Thereafter, we'll be going through literature review, formulating or framing of a hypothesis, defining objectives, the different types of research designs, the sample design, collection of data, etc. And finally, the ethical aspects as well as the institutional ethical committee. Next slide, please. So, what is research? See, in general, when we have an interactive, we usually have an interactive class. So if anybody would like to come in between, ask, you may raise your hand so that Dr. Anjana can actually let you speak in, and we can have a discussion in between the classes as well. So basically, what is a research? What does the word research mean? It was the term research was actually existing since 1577, and it was actually derived from a French word chercher or chercher, and re means actually to keep on doing it again. So it's actually to the actual meaning is to look for or do it again and again. So I would like to start the class with a quotation that was quoted by John W. West. He says that the secret of our cultural development has been research, which pushes back the area of ignorance by discovering the new truths, which in turn lead to better ways of doing things and better products. So, like, this usually happens with everything. It is not just one thing that the research is pertaining to. It happens in all the fields. It might be health, it might be science, it might be physics, it might be anything. They keep on searching for a better method, or for a better condition, or for the better aspects of doing things, and they come out with new ways. So the term research means again and again, to search again and again. And it is considered to be the formal, systematic, intensive process of carrying out a scientific method of analysis, which involves more systemic structure of investigation, and that usually results in some sort of formal record of procedures and a report of result or conclusion. So that is what the term definition of research means. You might have already received the notes for the researchers classes today. So in that, you can see that there are quite a lot number of definitions. So whichever you find most suitable, or whichever you find comfortable in writing or learning, you can learn that and write it if asked for the examinations. As per the Oxford Dictionary, it defines research as an endeavor to discover new facts, or correlate old facts by scientific study of a subject or course of critical investigation. So what usually happens is, you have something, and then you need to find out what exactly happens when it comes in relation with something else. So this is all about research. So when it comes to health, it is entirely different perspective, which we'll be seeing through the next slides. So if you ask whether there is any research activities going on in Ayurveda, or has Ayurveda ever promoted research, well, definitely yes. My answer would be yes. And as Priyavat Sharma says, you can see that Karya Karana Bhavasya Dravyanam Gunakarmanaha Pariksha Asthanam Samyak Anusambandhyad Uchyate Anveshanam Paryeshanam Gaveshanam Abhi Chodhaitya Paryaha Loge Samavidiyate. That's what Priyavat Sharma says about Anusandhana. You have the definition. Sometimes, even for the exam, it might ask what do you mean by Anusandhana, and what is Ayurvedic research. So you have to write this, and then keep moving ahead with the rest of research things. Next slide, please. So now, moving on, like, you might see, like, what are the characteristics of research? So why do we need a research kind of thing? So basically, it demands a clear statement of a problem. So why do we what is a problem actually? So suppose if you have to find a solution, you need to actually have a problem. Only when you have a problem, you'll start finding, or you'll start looking, or you'll start seeking to find out what are the methods by which we can tackle the problem. So the ultimatum of all this will be what is called as research. Suppose, say, you have you have something, or you want to go somewhere. You will actually start. Suppose if somebody wants to go to Delhi from Mumbai, you will start seeing what are the different options, like whether to go by train, whether to go by flight, or whether to take a car, how many persons are there. So your problem is actually you have to reach somehow to Delhi, and whatever methods that you're trying to find in the process that it takes, that you need to reach to Delhi, that actually is a kind of research, the most simplest way. Or another something what I can say, suppose if you want to buy a product, say for example, if you want to buy a television. So what you basically do is you'll start first of all looking about whatever what television is, what are the different types of television, how what are the different features of it. So all this is a kind of research. Likewise, when you kind of relate this with the health related events, then it is called as a health research. So it establishes the relationship between a cause and effect. Establishing a relationship between cause and effect, you might have learned in Ayurveda, it's like Karya Karana Siddhanta. Like there is a cause and there is an effect. it happened because of that. So same thing here also happens, like, what caused diabetes? There's actually a kind of research, or what actually does help to reduce the diabetes in a person, whether it is the administration of a particular drug, or whether it is the exercise that the person does. That is again another type of research. So it is trying to establish a cause and the relationship between a cause as well as the effect. So based on that, there is generation of principles, and you can therefore predict theories, or you can actually produce. See, for example, one of the best things that we can say is smoking causes cancer. So it was actually found out through a research that people who smoke can actually or they have a higher risk of developing cancer, and it is now a proven statement that, or it's actually a proven thing, that smoking definitely causes cancer. So this is all based on different kind of researches that has been happening. So this is, these are all based on observational, experimental, and empirical evidences. So sometimes you keep observing what is happening, what is happening to the human body, or what is happening to the things when you interact with certain things, and then you start experimenting on it. You actually give some chemicals, or you give some medications, and then you look what is changing, and then you have the definite empirical evidence of that. So for all those things, you need to actually have a deep knowledge of the subject, and definitely you should have an objective which should be logical as well. So objective is something, it is a kind of thing. So suppose being students, your objective is to complete the MD course successfully and to attain the degree. So that is your objective right now. When you're sitting in the class, you have to understand what is happening in the research methodology classes. Basically, research methodology classes are generally said to be kind of a bit boring kind of thing. But actually, if you start, looking towards, or looking keenly towards it, it definitely becomes interesting. And finally, all the research activities should be carefully recorded and reported, because this will actually pave way for the other generations, or for the next group of researchers to take up much more different activities, and develop much more better results on whatever you have done. So next, we'll move on to the scope of the research. Now, what is the scope of research? Next slide, please. Dr. Anjana, next slide, please. Yeah. So the scope of research, what do you mean by a scope of research? It's, how best can we apply the research into the current society? What is it actually that we are aiming to get from a research perspective? So the first thing is getting additional or new information. Suppose if you have a disorder or a disease, and you want to identify, or you want to see what kind of in which population is it more this particular disease is more vulnerable. Say for example, now I'm just telling for an example, is diabetes reported more in adults in the recent times? Or say otherwise also you can think, is diabetes more reported in people with in the age group of 30 to 40 when compared to earlier stages? So that is getting an additional information, or new information. So otherwise, what is the difference between, say for example, Mutra Krichra and Mutra Khada? Both supposedly seems to be similar kind of thing, but definitely there is a difference in it. So, what is the difference between these kind of thing? And again, you have the second scope is like you can verify and confirm the available information. For example, suppose you have, somebody says, okay, people who consume pre-cooked and packaged foods are more prone to develop complications of diabetes. So this is some sort of statement somebody says, and or which is already existing, because of packaged foods and pre-cooked foods and all, it definitely has different glycemic index, and chances for developing diabetes are quite high. So it is an information that you have, which is already there, and you're actually verifying that information. You're trying to confirm whether whatever information is being told is correct or not. So that is attained actually through research. Then, as I said in the earlier slide, explaining the cause and effect. For example, when it comes to health, it is seen that people or women who have breast implants are prone to develop breast cancers more. So the cause is actually the breast implant, and the effect is actually the breast cancers. So this is actually something that you are trying to find out with a kind of research activity. Okay. Then next one is testing of new drugs, vaccines, tools, or interventions for prevention, treatment, and control of the disease. Say, for example, many of you might have heard about smokeless stoves, which are used for cooking. So somebody wants to find out something, say that introduction of these kind of stoves, whether it will result in the reduction of respiratory morbidity as well as the mortality, especially in the rural areas. So this is a study that, so it's actually a kind of, method to prevent a condition in respiratory disorders. Likewise, suppose, somebody else wants to say like whether injection of a particular iron sucrose is better alternative to deal with pregnancy related anemia than oral medication or oral supplement of iron. So these are the different methods by which people can test new drugs or tool of intervention or prevention, treatment, or even control of diseases. So also it will help to evaluate ongoing programs as well as assessing feasibility of new programs. Suppose if somebody is actually introducing some kind of health programs, so already some programs are going on, and with the help of research, you may be able to find out whether these kind of programs is effective in controlling things. For example, whether integrated disease surveillance program will be helping to predict the epidemics of influenza and bird flu in India. That's a kind of a program that is going on. So that will help to find out whether the occurrence of disease or prevalence of the disease and things like that. So when you come to Ayurveda, what is the scope of research in Ayurveda, or what does Ayurveda has to do with research? Is yet another one issue. So Ayurveda has its own methodology. So one main thing that I would like to state is that modern research methodology is quite advanced, and they have a very fixed protocol or a framework in which research methodology is done and in which research is carried out right now. Ayurveda is trying to develop its own kind of research methodology, but presently we follow the footsteps of modern research. So it is at par. It is not at par with the modern research, though. So you might find a lot of lacunae in Ayurveda research methodology, but there are evidences that Ayurveda also did follow research quite well. And for the example of that is Panja Avayava Vakya, which is Pratigna, Hedu, Udaharana, Upanaya, and Nigamana. Pratigna is actually, you can correlate it with a hypothesis. A hypothesis is actually a statement that somebody puts forward in when it comes to research. It's a statement that you actually put to test that will be told or dealt with in the upcoming slides. So for carrying out any research, there should be some steps or procedure by which a hypothesis is actually studied. So this systemic procedure is actually called as a research methodology. And as far as Ayurveda is concerned, we always depended upon the Pancha Avayava Vakya, which is Pradigna, Hedu, Udaharana, Upanaya, and Nigamana. Pradikya means hypothesis. Hetus, we call it as causative or cause kind of thing. Here it is related to supportive theory. So suppose if I put a statement, say this causes diabetes. Sugar causes diabetes. So there should be some supporting elements for supporting my statement that or supporting my hypothesis that sugar is causing diabetes. So then you go for udaharana, that is example. So now I'll say, this particular person was consuming sugar for so many number of days, and he has developed sugar or diabetes right now. So that's an example that I can show. Then you go for something called as upanaya, which is actually the acceptance. And finally, you accept whatever you're trying to say, or you try to prove, and you establish the sort of principle. So this is actually the scope of Ayurveda, and I would say that this particular portion is somewhat asked in the examination papers as well. So it would be better if you can go through the notes, whatever is provided. It is given as per the syllabus point also. Okay, next slide, please. Okay, now what are the dimensions of research? Like dimensions means, in what all things you can do the research. So here, whenever I'm speaking, we are to take it in the aspect of health research. In health research, there are theoretical research as well as applied research, preventive as well as therapeutic research, bench-based research and bedside research, exploratory research and confirmatory research, implementation research and translation research. Now, what do you mean by theoretical research? And what is applied research? So suppose you are reading Ashtanga Sangraha or Charaka Samhita or Shushrava Samhita. You come across a particular statement wherein it says like Nidigdiga Hingu is actually very much helpful in controlling Kasaroga or Shwasaroga. So this is a statement that is being told in theory. Now you keep on searching about Nidigdiga or Kandagari, it's otherwise called, and you keep on searching about Hingu. You read about all aspects of Shwasa, and then finally you come across, or you come to see that, okay, theoretically, whatever is being told in the textbook is correct. But now, unless and until you start giving it to a person or giving it to a group of persons, you will never know the efficiency of or whatever is being told is correct or not. So now, when you put that into an application level, that is called as applied research. So it has this is what the major difference between these two happens. That is theoretical research as well as applied research. Whatever you learn from the textbooks is being applied onto either human beings or onto the animals to see whether if these kind of things work. Now, that is called as theoretical research and applied research. Second one is preventive aspect, as preventive and therapeutic research. Now you have different says like Yoga Anutpadaniya Madhyayam, chapter 5 of Ashtanga Sangraha. It speaks about a lot of things wherein says where it specifically highlights whatever a person should do, especially not to do, especially not to stop themselves from the natural urges. So if you suppose if somebody stops the natural urges, it just says the person is succumbed, or the person is believed to develop so and so kind of diseases. So now, if a person follows the dinacharya, ritucharya, as well as the if he does not stop any sort of natural urges, he is generally said to be what? Disease free. So there are a preventive aspect of the research aspect. Now, you can also say when it comes to a certain medication, say like taking of or intake of Indukandam Kashayam will help the persons to fight COVID-19 situation. So that is some kind of preventive aspect wherein you can actually give Indukandam Kashayam or say another compound to a group of people and see whether they will develop COVID-19 in the later stages. So suppose the result comes they are not developing, it means that is actually a preventive aspect that you're learning. Similarly, therapeutic research. Likewise, a person who is developing COVID-19, and if you're giving some medications in order to reduce the intensity of the symptoms of COVID-19, or even the complications, whatever the person has after developing COVID-19, that is called as a therapeutic research. The next one is actually a bench-based research and bedside research, which is again similar to that of theoretical research and applied research. Here in bench-based research, people usually do in vitro studies. They study on animals, they give medications on rats to see whatever, and they see what, after giving the medication, what happens in the animals. And the bedside research is, this result is actually taken forward. With the help of this support, they'll say, okay, this can also work in human beings. So that is the difference between bench-based research and bedside research. The next one is exploratory research and confirmatory research. It is similar to you can keep exploring. Like I said, nidigdiga hingu. And confirmation is actually by giving it to some patients. Then you have implementation research and translational research, which is again similar to that of bench-based research and bedside research. Now, you might ask, why do we need research in Ayurveda? What is the reason? Okay, so the definition of Ayurveda and the purpose of Ayurveda itself says, swasthasya swasthya rakshanam adarasya roga nivaranam. So it is the maintenance of health and the treatment of disease. And actually, it also helps to find out whether the nidana has a specific relationship with the formation of disease. And also, it is considered to be an integral approach of Ayurveda with modern parameters. So that is what I said earlier. We are still in an infant stage of developing our own methods and protocol. And we currently follow, the modern system or the modern medications, the modern research methodology. So there are quite a lacunae, especially when it comes into the research. Being a researcher, there are quite a lot of lacunae, quite a lot of issues that we face whenever we put forward our methods and try to, for example, Gridrasi is something that we want to do a research. And we have only parameters that is being told in the textbooks, wherein it says, spikpurva kadi prishta urjanu janga padam kramat. So the pain nature. And whereas in modern system, it is very clearly stated that, it is actually sciatica. And sciatica can be definitely diagnosed with the help of an MRI or with an SLR or with a femoral stretch test. But in Ayurveda, we do not have any confirmatory sort of methods. We have to depend upon the lakshanas that is being told, which is why Ayurveda, most of the research works are subjective and not objective kind of thing. Okay. Now, before moving on to the research question or research problems, we'll actually go through what is a life cycle of a researcher. How does actually a research form? How is it coming? Doctor, next slide, please. So you can see that it's actually a flowchart kind of thing. So the first one is you identify a problem. Suppose say take the current situation of COVID-19. It has been there since last year. Oh no, year before last probably. So that was actually a problem that everybody faced, the whole world faced. Different people started coming up with different solutions. Now, how did that solution come? Because there was a problem. Now, most of us might have been or might have taken the vaccine, Covishield or Covaxin. How did the Covishield or Covaxin come? That is actually an end product or an end result of research. Now, what was the end? What was the problem? COVID-19 was the problem. So here, identifying the problem. So first thing was you have to identify what problem you have. So, since you all belong to the first years, now it might be time for you to submit your synopsis for the research works. So it is your, you have to identify a problem where you have to do a research. So before you have to do a research, you have to identify what exactly or which portion do I need to do a research, whether you need to do a research on diabetes, or whether you need to do a research on any orthopedic related issues, or whether it is any sort of mental related issues. So that is the first step that happens in any research work. The second thing is, once after the research problem is identified, you have to actually ask a question. Okay, asking a question means it is spelling out a research question. We'll be detailedly going through how to formulate a research question in the upcoming slides. In fact, the next slide we'll be going through that. So research question is actually, it is being asked by the researcher. Okay, so and so condition. If I give so and so, medications, or if I intervene in such a way, whether it will produce any result in bringing down the symptoms or whatever you're looking forward to. So that is actually a question that we put forward. Once after we put forward a question, then we actually formulate certain objectives. Okay, now after putting certain questions, I say, okay, these are the objectives that I'm going to look forward once when I start doing the research. That is the formulation of objectives. And then you plan the analysis, like, okay, let me plan how it can be done. What all should be the steps that I should be taking in order to attain the objectives. That is the analysis. And then once after that, you prepare the data collection instruments, like say, for example, K-sheet is one of the data collecting instruments. So you ask a patient about their health whereabouts, and they take everything. You collect whatever data is available in that, and you prepare, you collect the data, and then you subject the data for analysis. That is usually done through statistical methods. I think statistics will be taught to you by a different sir. So once after the statistical analysis is done, then you come into a conclusion saying, okay, whatever statement I have put forward is true or is not true. And then you formulate certain recommendations based on that. And finally, you inform the stakeholders. Stakeholders are like, it can be either a organization, or it can be a government agent, or it can be even certain company. So this is about a general life cycle of a research. Next, we'll be moving into the selection of a research problem or a topic, or actually even a question. Next slide, please. Okay, selection of a research problem. So like, first thing is, why do we need a research question? Or what is a research question, and why do we need a research question? So a question usually comes only if there is a problem, as I said earlier. So in case of research, in case of our research, it is usually connected with health and health-related aspects. So, research problem is actually a situation that needs, a situation that is in need of a solution, or improvement, or even alteration, or a discrepancy between what is existing or partly known and the truth. So basically, it is, you have certain uncertainty. There is some uncertainty about something in the population, and the investigator actually wants to resolve it by making measurements in the study population. Suppose, for example, you want to see how many persons in, say, in a school you go, and you, in a high school you go, and you say, okay, obesity. How many of the children in the school are obese? And how many of these obese children are prone to developing diabetes? Now, this is actually a question that you formulate. Okay, so you're not certain about that. So there is some uncertainty that is there, and the investigator is actually trying to look into the study population here. So here the population is actually the school students, and especially the obese school students. Okay, uncertainty is completely whatever is not clear to us, and that once you start collecting the information about the uncertainty, that becomes the data, which is why uncertainty is otherwise known as a data needs. So you need to actually ask a question to yourself, or you need to actually formulate, or you need to actually frame a question in order to felicitate or facilitate a proper research design. So this a clear question will actually help to choose the most optimal design that we need to take, and it also will help to identify who all should be included and what are all the changes that you're expecting to. We call it, in the research terms, we call it as outcomes. Outcome is like, suppose if you are planning to give, say, a kashayam called Varanadi kashayam to a person who is having obesity, or who is obese, and you are expecting the person's obesity to get reduced. Say, for example, a BMI of 40 or more, or if a person belonging to a weight category of 100, you are giving Varanadi kashayam for a period of 2 months. What outcome you are expecting is his weight should be reduced by this many number of kilos, or his waist length should be reduced by this many number of inches. So that is the outcome that you're actually looking forward to. But before all that, you need to actually formulate a question. So formulating a question means, it's like whether administration of 15 ml of Varanadi kashayam twice a day, morning, in empty stomach, to persons diagnosed or persons having a BMI of 40, help to reduce their weight. There's some question. Now, suppose, if it is just BMI that I'm looking forward to, or if it is something else that I'm looking forward to, whatever it is, everything should be clearly mentioned in the question itself. That is, which is why it is said, a clear question will always facilitate the most optimal design, and it will actually, identify who all should be included and what are all the outcomes, and when you should be measuring these outcomes. Okay, so now we all might wonder, okay, how do we identify a problem, or the sources of different research ideas of research problems? Dr. Anjana, can you just unmute some of the students? Hello.
Yeah, doctor.
Yeah, can you just unmute, because I just want to ask them, and I just want to take a break and ask. Are you following? Okay, probably you can unmute. Doctor, to identify a problem, first of all, you need to have certain experiences that is from clinical, or even it can be from a clinical experience, which is like, suppose I'm a person after completing or after sitting in the, you're sitting in the BAMS class, clinical classes. You're sitting with your teacher. The maximum number of patients that comes to you in the clinic, in his clinic, is persons with orthopedic issues. Now, what kind of orthopedic issues does the person have? Is it knee joint pain, or is it, some other issues, like whether it is back pain or kind of thing? So it is actually through clinical experience one can attain the what do you call? So he identifies, okay, now this is a burning issue in a person's life. So you understand that, okay, knee joint pain is a problem, and then you want to you say, okay, fine, let me work on knee joint pain. Let me work on this. Let me start developing some medications or developing some protocols to identify or to rectify this issue. Now that is through clinical experience that one can get an idea about a research problem. Second one is peer interaction. Peer interaction is actually a person starts to talk with his fellow beings or fellow group of doctors, wherein they say, okay, see, I've been in my clinic for so many times, so many years, and my clinical experience says that these are the number of cases that usually comes to me for the maximum. So that is some kind of interaction, wherein peer interaction that one gets. Then you have literature review. Suppose if somebody is a person who's not interested in clinical aspects, or who's somebody who's completely dependent upon books, he keeps on reading books, and there he identifies there are certain interests or area of interest somebody would like to pick up on. So that is called as literature review. Some might keep on reading the textbooks, and then they will find, okay, like I said, a particular compound is being utilized or it is being said in a particular condition, wherein they will take up, okay, let's start finding whether this works in this condition. So that is theoretical knowledge. So apart from that, persons who attend a lot of research meetings or conferences and have a skeptical attitude. Skeptical attitude is like whether he has a doubtful attitude about certain beliefs. So suppose it is said that drinking bitter gourd juice will help to reduce the diabetes. So that is suppose somebody comes up saying that I am diabetic. The first thing that a household person will say is, start drinking the bitter gourd juice. It will help to reduce. So that is actually a belief. Now, a researcher will always have a skeptical attitude, whether he'll think, okay, now is it correct or not, and he'll start working on such kind of things, and do activities, ask questions whether this works or not, and he will come into a conclusion. So these are the different sources how you can actually identify a problem, or these are the different sources of research problems that one can get to. So next we will go to the characteristics of a research question or a problem, and how or what all things should one develop in order to develop a question. Next slide, please. So, characteristics of a research question or a problem is, first thing is the topic must be easy to understand. Suppose if you're picking up a topic, it should be quite easy to understand. Means you cannot, suppose somebody says, put up a lot of big terms in the research title, and then it is quite difficult to understand. So it says the topic must be very easy to understand, and the topic should be well defined. That means it should be just focusing on one simple issue, and it should be in specific terms, that is clinical or public or health. And it is usually written in a everyday language, which means it's a simple language. There is no use of technical terms at all. So suppose if I say if you use a lot of statistical terms or a lot of things which somebody is not able to understand, then it is not a good thing to it's not a good characteristic of a research question. And finally, the topic must be of great importance in the current day. So, for example, now if you're choosing up a research topic for a research activity right now, the best suggested topic would be on COVID, because it is a burning situation right now. And once after you have selected a problem, then that problem should be put forward into a question which should actually pass this following thing. That is why it is said a good research question should pass so what test. So what means, it's actually, so whether it is feasible. Feasible means whether the whatever you are, you know, whether you have an adequate number of participants, technical expertise, and resources to do a research. Second thing is whether your research topic is interesting. That means whether if there is whatever you're choosing, if it kindles an interest in people. Third one is it's novel. Novel means it should be something new. That means it should refute or confirm previous findings, and it should provide a new information. It should be ethical as well. Ethical means, it should be amenable to a study that ethics committee will approve. You cannot give medications which will harm a person's health, or you can, something which is not, approved by everyone. So those are all called as ethical considerations. And finally, it should be relevant. Relevant means it should actually help to advance the scientific knowledge, and it should improve the practice as well as influence a policy. It should actually help to influence a health policy in the current or in the given scenario. Next slide, please. Now, steps in forming a research question. Now, in order to form a research question, you should actually first step is review the state of art information. So in order to form a question, first of all, you identify a problem, and after identifying a problem, you should actually have an in-depth knowledge about whatever is being told in that about the problem. So, for example, exercises reduces blood sugar or body fat. Now, that is, you have to completely have an information about all the exercise. You should know about what is happening with the blood sugar or body fat, and whether so you should have all the information about that. And next thing is you raise a question. Raising a question is, okay, can exercise help controlling the blood sugar level? But here the problem is, it is quite vague. So you need to clearly exercise, or you need to actually define what exercise is, and how much amount of blood sugar level, everything. And then third step is decide whether it is worth investigating by a peer review. Peer review is actually persons who are in the same field. So then when it comes to the next level, the question will be like, what is the level of reduction in blood sugar, whether it is fasting or whether it is postprandial. What are the optimal type or frequency or intensity or the duration of exercises? Now, what are the risk and what are the other benefits? So the question keeps on improving at each level. And then next step is define measurable exposures and outcome. Here the exposure is the exercise, and the outcome is the reduction of blood sugar level. So you frame the question again like predetermined physical activity comprising of any body movement produced by skeletal muscle resulting in an increase in energy expenditure. At least one session or 60 minutes every day for 1 year. It could be either walking, jogging, or cycling, or aerobic. Any kind of thing it can happen. Any kind of exercises can be there. And the outcome is the fasting blood sugar level, reduction of fasting blood sugar level. So final step is refining or sharpening the question by specifying the details. So keeping in all the aspects which is said before, we kind of reframe the question into, among diabetes, does physical activity for 1 hour daily help in reducing the fasting blood sugar level? So this is actually the question that the person can ask. And in order to refine the question, they should have these many kind of things in the question. They should be mentioning about a population. They should be mentioning about an intervention. So population means a group of people of age group. Intervention is actually the method or whatever measures that you're taking in order to bring down the blood sugar level. Comparison is usually given in order when compared to a standard medication that is given. Outcome is reduction of the blood sugar level, fasting blood sugar level, and time is whether within 1 month or 2 months or whatever it is. Okay, so these are the steps in order to these are steps taken to refine a research question. Next slide, please. Literature review. So what is a literature review? Literature review is probably the most important preparatory work for doing a research work. Basically, in order to do a good research, it involves a good literature review. It has you need to actually identify the appropriate research question and methodology, and also use the optimal use of data. So a literature review actually it takes you forward to what do we know about the topic so far. Suppose if somebody wants to do about do a research on diabetes, he or she will actually tell, he should be or she should be knowing entirely about the diabetes. And so in order to do that, he or she should be able to, or she should be analyzing the entire research activities which are done recently on diabetes, so that it will be easy for them to critically appraise or critically say about whatever is known. Suppose if somebody goes and say, okay, now I've gone through the literature review in these many, I've read so many articles about diabetes. I've come to see that none of these articles, nobody has studied about bitter gourd and its relationship with diabetes or blood sugar. So that is something that you come up with when you have a lot of reading, when you do a lot of reading. So that is what we say, what do you have to say critically about whatever is already known? And again, has anyone done anything exactly as the same as whatever is proposed? Which is again like, suppose if I'm going to do a work wherein I'm going to see the result of Eganayagam in diabetes. So when I search for the the articles or the research works published, I look forward to see if people have already done work on Eganayagam. Suppose if somebody has done work on Eganayagam, then there is no point in me doing the same kind of thing. So I would rather change some of the aspects in my research and then do another research activity. So has anyone else done anything that is related to it? Suppose if somebody has done some works on Eganayagam, I would be actually able to take up some of the aspects from that research works, and then that will help in improvising my research activities. Where do your research work fit in? That is, you have to ask yourself, where does actually the research work fit in? Whether our research work is helpful in filling up the gap of the previous works, then definitely you can say, okay, whatever work you've taken is good. And why is your research work doing in the light of what has already been done? Which means, how is your research work worthy? So far, if the whatever works you have done is not so far whatever research works have been done is not yet kind of answering your issues. Definitely, whatever questions that you have placed is something that is acceptable, and then you say, okay, this is why my research work is worthy. So this is literature review helps to kind of attain or go through all these things, and helps us to understand better about the subject as well as about the subject research works that whatever it has been done. Next slide, please. Now, how do we go about the different literature review? There are a lot of literary resources. you can go through old books, publication of research articles or journals, previous dissertations or thesis, reference works, government publications or official statistics, websites such as Google for general query. And if it is for specific queries, you can go for PubMed, Scopus or Google Scholar. So these are all, the aspects, or these are all the different methods by which a person can do a literature review. So now, why do we need to read a literature review? Is actually in order to, how do we write a literature review? First of all, you need to actually have an introduction where you will say what is the purpose that you're writing, and you need to organize it in a particular method. And there is it is always said the recent works has to be first kept, then followed by the previous works. So, and also the most important one to the least important one. Likewise, earliest to the most recent. These are the things in which you have to organize a literature review. And it should, your literature review should include quality study, which are relevant to the topic, and explain the study using, you should, rather than using direct quote whatever the previous researchers have done, you should be actually paraphrasing your or formulating someone's ideas in your own words. That is called as paraphrasing. And whenever you critically appraise, it should not be a critical appraisal, but it should be a scholarly appraisal. Scholarly appraisal means you can just find out, okay, you shouldn't find out each and every bad things about a research work. You should find out whatever is not given in that and try to improvise it in your work. That is what is called as a, that is a aspect when you're doing it in an empirical literature. And finally, when you summarize your literature review, it should have a concise presentation of the research knowledge about a selected topic. To keep it most simple, we have to say what is known and what is not known. That has to be mentioned in the literature, the summary of the literature review. Next, we'll move to formulating of a hypothesis. I know it is like the time is running out, but still, I'll try to finish it within the given time. So the next one is actually a formulating hypothesis. Dr. Anjana, can you just change the slide, please? Now, what is a hypothesis? Hypothesis actually, as you can see, it is defined as a tentative explanation that accounts for a set of facts and can be tested by further investigation. Basically, it is something that you propose on a basis of limited evidence as a starting point for further investigation. Now, I can put a hypothesis that drinking green tea will help to reduce cholesterol. This is something that I'm putting as a hypothesis to start an investigation. So in order to start an investigation, now what all things that I need to see is, first you have to select actually persons for persons with high cholesterol. You need to administer them with green tea for a period of 1 month, and then you check the cholesterol again. And suppose the person's cholesterol is coming down, I say that my hypothesis is accepted or my hypothesis is true. Okay, so basically hypothesis means a supposition or a proposed explanation which is made on a basis of limited evidence as a starting point for that is usually used for a further investigation. So the definition is, it is defined as a tentative explanation that accounts for a set of facts and can be tested by further investigation. So in order to put forward a hypothesis, there needs to be a nature of hypothesis, which is given in the slides again. It is a clear statement. So clear statement means it should be very, very crystal clear. Second thing is, it should be specified before the conduct of research, and it should be openly stated in the reporting of the result. You have to state, okay, my statement is, it's a clear statement. Green tea reduces cholesterol. That's a statement that I'm putting forward. So it's actually a research question or objective reworded in a testable form. So it's a clear statement and it is specified. So I'm going to conduct a research on people having cholesterol. who is given green tea. And whatever I'm trying to test is that after giving green tea, I'm saying that the cholesterol should be reduced. So I'm testing that. So the statement is clear and it is specified in the conduct of research and it's open. And suppose at the end of 1 month after administering green tea, I find that nobody has reduced cholesterol. Whatever I have received in that should be published. That is something we have to say. Third one, it is express the relationship between two or more measurable values or variables. That is, variables are things that you actually kind of measure. So it is, drinking of, reduction of cholesterol, reduction of LDL. These are all variables that we see. And fourth one is it should be testable and be more specific. That means it carries clear implications for being tested and the state of relation. So it is considered valuable even if it is proven false. Like I said, at the end of the result, I say that, after giving green tea for a month, I find that it has not helped in reducing cholesterol. Now I have to say it is valuable. So I can at least remove the changes or remove the idea or the notion in people's mind that whoever is taking green tea it will not reduce the cholesterol. So that is something that I can prove. It should be simple and it should be concise. Means it has to be very very simple and it should be very crisp. That is what these are the nature of hypothesis. Moving on to the next slide, the characteristics of a good hypothesis. First thing is conceptual clarity. Means it should consist clearly defined and understandable concepts, and it should be very much acceptable and easily communicable. Second one is empirical reference. Variables should be used in empirical realities. Third one is objectivity. Objectivity means it is very clear. It should be very, very objective. It should facilitate the objectivity in data collection and keep the research activity free from researchers' value judgment. Fourth one is specificity. Specificity means it should be more specific and it should not be general. Okay, for example, administration of green tea will help to reduce the LDL. Now that is more specific rather than saying administration of green tea will help to reduce the cholesterol. So one is specific, the other one is general. Okay, then it should be relevant. So relevant means it should be relating to the problem that is being studied, and it should be also one of the objectives of the study. Suppose green tea will help to reduce the, it will help to retain youth. It is not at all relevant. The study is actually on cholesterol, and somebody says it will help to reduce help to retain the youth. That is not relevant here. Testability means it should be testable. Means it should be it can be counted or it can be tested and to see if it is working or not. That is testability. Seventh one is consistency. Consistency means consistency means should be very much consistent with an existing body of theory. So already there should be some theories that should support this, and they should be consistent with that. It should be simple, like I said, where it should be formulated in the most simple form and understandable form, and availability of techniques, which means researchers must be able to must make sure that the methods are available for testing their proposed hypothesis, and also these techniques has to be available. And if it is not available, the researcher should be in a position to develop suitable techniques. And finally, it should be purposive. Purposive in the sense, it should be one purposeful hypothesis should be formulated, which has relevance to the research problem as well as the objectives. So these are the characteristics of a good hypothesis. So you'll be able to understand once when you start, formulating a hypothesis when the research work comes. Now, categories of research, there are a lot of hypotheses, which is like simple and complex hypothesis, directional and non-directional hypothesis, causal and associative hypothesis, and finally null hypothesis and alternative hypothesis. So usually in a postgraduate level, the normal hypothesis that when we say, it's actually the null hypothesis and alternative hypothesis that we take. So in the null hypothesis, you say that, okay, this statement is not functioning. Whereas in the hypothesis, you come to say that alternate hypothesis, it says that it accepts whatever is it. So null hypothesis, it says a statement, there is no actual relationship between the variables. There is no connection between the variables at all. It is designated either as H0 or Hn. So it is the statement which is given in the opposite form where the experiment would be expecting. Suppose my hypothesis is that, what I'm trying to find out is green tea will help to reduce the cholesterol. My null hypothesis would be drinking of green tea will not reduce the cholesterol. That is a null hypothesis. So you are actually testing a null hypothesis, and at the end of the test, you come to know that, okay, suppose if the cholesterol levels have reduced after drinking the green tea, my alternate hypothesis would be that drinking of green tea will be helping to reduce the cholesterol. Now, I reject my null hypothesis and we accept the alternate hypothesis. Okay. So next one is defining the objectives. Now, what do you mean by a research objective? A research objective is a very clear, concise, declarative statement which provides a direction to investigate the variables. And the characteristics of research objectives that it should be very specific, it should be measurable, and it should be attainable. I mean, specific means, it like we said again, so like we said earlier, it should not be vague, and it should be measurable, and it should be attainable. Attainable in the sense it can be attained, and it should be realistic, and it should be time bound. So these are the characteristics that usually we see in characteristics of research objectives. And there are different types of research objectives, which is general objective and specific objective. General is like, say, you have, it's a general kind of thing that you say. For example, what the general objectives of the study, the researchers expect to achieve the study in a general terms. Whereas specific objectives will be focused on specific issues, and usually the specific objectives are more in number and systematically addresses various aspects of problems as defined under the statement of problem. Okay, so next is actually a research design. A research design is the arrangement of conditions for collections and analysis of data in the manner that aims to combine relevance to the research purpose with economy in procedure. There are a lot of research designs. So like I said, in order to, suppose if we have chosen a problem and we have decided to find out the solution for that problem, then we actually kind of start looking forward to developing a design. Like I said initially, if we are trying to move to Delhi, and we look forward to a lot of options, and finally you come to a point that, okay, fine, we are planning to go by car. Now, when you are planning to go by a car, you need to actually design a lot of things. You need to plan a lot of things. So this same thing happens in the research design itself also. So it is actually an arrangement of conditions for collection and analysis of data in the manner that aims to combine relevance to the research purpose with economy in procedure. Finally, the types of research design. You have a lot of research design, which is like observational design, interventional design, descriptive research, analytical research, preclinical research, clinical design, quantitative design, and qualitative design. So, I'm not explaining the entire thing right now because it will take more time. It will be given detailedly in the notes, whatever it is being given to you. You may go through it, and if you have any queries, either you can email me or ask me in the next class. Okay. Next slide, please. Moving on to a sample design and collection of data. Suppose in order to do a research, you need to actually have a sample. Now, what do you mean by sample? Sample is actually the representation of a entire universe. Suppose we believe that each person or whoever is there, it represent whoever the patients is actually the representative of the whole universe. So we need to actually kind of do a sampling before we take up any research activity. So there are a lot of types of sampling. The most common thing is probability sampling and non-probability sampling. Among the probability sampling, probability, as you have learned, probability, permutation, and all in the mathematics, there are equal chances of being selected. The best example that I can say is taking up a lot. Suppose a lucky dip. You go to a mall, there are some lucky dip. You write down your name and number and put. So we believe that, you have a chance of getting selected. So that is what is called as a probability. Among probability also, you have 5 different types like symbol random sampling, stratified sampling, cluster sampling, systemic sampling, and multi-stage sampling. Simple random sampling, like I said, you randomly pick up someone. Say, for example, you have 5,000 people, and you assign from 1 to 5,000, you allot different numbers, and then you randomly pick up, say, number 5. So that is randomly taken. Then then you assign every 10. So like 10, 5, 15, 25, 35. That is actually a kind of random sampling that you do. Like stratified sampling is stratified is actually divide the person, say male and female is divided, and then from male and female you again kind of randomly pick up person. Clusters, you divide the class people into different clusters, male, female, Hindu, Muslim, Christian, like that you divide, and then you actually kind of pick different persons. Systemic is actually you divide the persons into a proper systematic method, and then take up arranging the population to some kind of sequence, likewise in something like in a direct way, or an index of cards or something like that. And multi-stage sampling is usually done if you have to do a research, the country-wide kind of thing. So you divide the country into 4 different zones, and from each zones you select up a few states, and from each state you randomly select a few districts, and from each districts you randomly select a few villages or panchayats or taluks or such things. So that is multi-stage sampling. So whenever you do a research work, what we should be probably avoiding is volunteer sampling and convenient sampling, which means you purposively take persons. So that should be always avoided. Now, once after all this, you have to collect data. Data, there are 2 types of data. One is quantitative and the qualitative. Quantitative means it is something which is measurable, and qualitative is usually something which is you ask and then you get the feel about it. So quantitative data, there are 3 types of quantitative data collection. One is interview method, which is like a person sits and asks the patient like whatever the question, a questionnaire can be answered, or there are a certain questions that will be asked, and then the interviewer takes the answers from the person. Second thing is observation. Observation is you observe whatever changes are happening, and then that is being understood and taken. And finally, questionnaire method, wherein you will be given questionnaires. sometimes at one or the other point of your life also, you might have received some questionnaires wherein you might have given tick or answers to certain questions. So that is actually again collection of data. Qualitative methods is like a case study method. When you all take up a case sheet, write down from the patient details, everything, and then collect the information. That is called as a case study method. And the focus group discussion means we have a group of people with similar characteristics, and then you sit together and then you have a discussion. That is called as a FGD or focus group discussion. Next, we'll be moving to the ethical aspects in a clinical research. So whenever we do a clinical research, there are quite a lot of things. Like we said, initially when we choose a topic, it should be ethical. We said about ethical, right? Likewise, there are a lot of things which needs to be followed when related to the clinical aspects. So the principles to be followed is that it is first thing is essentiality. So whenever we are involving a human being in a clinical research, first thing that we need to make sure is whether if a human needs to be involved or not. Are there any other methods by which we can do the same thing? So only if we consider all the options, and if we say all other options are considered, but none of them can be, or none of them are, cannot be taken. Only at that situation, then we can say that, okay, ethically this can be approved. Second thing is volunteerness or informed consent. That means whoever we are subjecting the person to a clinical research should be told or should be informed about whatever research that we are going to give. So suppose if you are going to give a medicine to a person, you should be informing them that, okay, you are being given so and so medicines, and it should be these are the benefits of it, these are the plus points of it, these are the negatives of it. That should be actually informed. Third one is non-exploitation. Means usually when we do a research work, it is said that whoever is participating in that research should be given a remuneration. So suppose if as a person, that means if you are doing a research and you say that your blood works will be whatever blood investigations that will be borne by the investigator. Suppose if a poor patient comes, you go get the blood test done, fine. That is instead of it's another way of remuneration. But if a rich person comes, you will feel, okay, this person has money, so let him do it himself. That is not accepted. That is why I say it should not be exploited at any cost. Third one is privacy and confidentiality. Suppose if I come to your clinic and if you find that I'm an interesting case of some condition, you take up all my data, and tomorrow you after treating the condition, you are successful in treating my condition. If you want to publish that data, you say, okay, Dr. Surej was my patient. That is violation of privacy and confidentiality. You should never be doing that. In case if you want to publish the data, my pictures or my data, you have to actually inform me and then take my consent, and then you can actually change. You should change the name and as well as mask areas which will help another persons to identify me. So privacy and confidentiality should be taken. Then principle of precaution and risk management. Precaution and risk management, suppose if in the clinical trial if some problem comes, that should be managed. And you should have all the precautionary measures also in order to kind of manage the problems. Then you have maximization of public interest. That means whatever you get from the research work should be given for a public thing. It should not be kept confidential, or it should not be kept to be for any sort of personal gains. Then professional competence. Professional competence means whoever is involved in the research activity, sorry, whether the research means whether it is competent enough so that whoever is involved in the research activities should be completely informed what is happening. Likewise, accountability and transparency. Whatever research work we are doing should be conducted in a fair and honest, and it should not be impartial at all. And everything should be disclosed to whoever is associated with the thing. Suppose if I have a person doing a research work with me, and if I get an information in the research, I do not share that with the other person. That is not ethical. I have to share. Okay, I'll say, see, this is what has happened. Likewise, then public domain, institutional arrangements. Institutional arrangements means, whatever. Suppose if I don't have a particular machine, say to investigate a particular condition. There is a hospital or an institution nearby where my clinical researches happen. I go and tell them I have such an issue, and we have to have a proper mutual agreement between us, and then that can be done. That is institutional arrangements. And whatever results what we get, should be used for a public domain. And totality of responsibility means whether it is professional and moral, for due observance of all principles and guidelines should be as per the research work, research ethics. And it should have a compliance. Compliance means whether it is general or positive duty on all persons conducting a research associated or connected with a research entailing the use of human subjects. So that should be based on a particular guideline. Next, we move on to the institutional ethics committee. I mean, these portions you can just go through the notes, whatever is given. And if you have any doubts, like I said, you may ask me the next class. Okay, now institutional ethics committee is actually something which is an independent body, and it should be there. It should be mandatorily there in all the PG institutions, and it is constituted of medical, non-medical, scientific, and non-scientific members who are responsible to ensure the protection of rights and safety and the well-being of human subjects involved in the trial. So they'll be actually seeing, suppose if I put up a project, the institutional ethics committee will go through and you will see whether everything is ethically correct, and then they'll approve or not approve my studies. So an institutional ethical committee, and it's a multidisciplinary, multi-sectorial in composition, and it should contain 8 to 12 people. The members of an institutional ethical committee, the chairperson, he should be usually a person outside the institute. There should be 1 or 2 medical scientists and 1 or 2 clinicians from different institutes. 1 legal expert, means legally expert who has passed LLB, or he should be a judge or someone retired. And there should be a social scientist or a representative of a non-governmental voluntary agency. There should be 1 philosopher or a theologian, and 1 layman. Layman is somebody who's not unaware about any of this, who's unaware about any of this. And so when he listens to it, he should also feel, okay, this is something good for the society, let it be approved. And then there should be a member secretary. The member secretary should be a person from the institution itself. Rest of all other persons should be from outside. The chairman can never be from inside the institution. So these are the members. Usually these are asked as a questions also. Now, once, what are the functions of ethical committee is that, in order to provide the competent review. So there are 3 types of review that is being done. It is a full review, expedited review, and exempted from the review. That means, suppose if my project work is done, and they find that some problems are there, then they'll be actually saying you have to go for a full review, because there are a lot of minimal risks involved. Expedited reviews, the minimal number of minimal risks are less. Then it's just like an expedited review. And exempted reviews, there are no minimal risks at all. The first one, there are a lot of more than number of minimal risks. So such kind of thing, they will be highlighting it, and that is a function of institutional ethics committee. Okay, so with that, I think we'll be ending up the first session. If you have any doubts, you might ask me right now, or you can even email me. I'll try to answer the questions. Dr. Anjana, I think I could. Hello?
Sir,
Okay, come on.
can you hear me?
Yeah, I can hear you. I can hear you.
Okay.
Hello?
Hello?
Okay, are you? Okay, come on.
Yes, sir, I can hear you.
Okay, okay. So I think, if any students have any doubts, they might ask me right now, or you can, share my email address to them. You can also share the slides to them also.
Okay. Now the participants can ask queries.
Okay, how to study research subject is it's feel very hard to study. Okay, Priya. See, I know it is. That's what I said. First of all, I said, it is usually considered to be a very boring subject. But if you try to learn it by hearting it, it's going to be tough. So my suggestion would be relax and then read. Try to understand what is happening, and then try to make notes on your own in your own words, in which way you can understand, and then you write it. You prepare notes on your own words rather than sticking on to a particular textbook. Then it will be easy to study. It was difficult for me also to study when 10-15 years back when I started learning also. It was a bit tough, but you will come across it. You will be able to make it much more easier if you do it in this way. I hope I'm clear to you, Priya. Anybody else? Any questions?
Oh,
Anjana, Doctor?
there is no queries.
There are no queries, I
Yeah,
believe.
doctor, we can
I
wind up.
think wind up. Okay. So, like
Thank
I
you,
said,
doctor. It
yeah,
was a wonderful session.
Thank you, thank you. I mean, I hope the subject is a bit like I said. How can we understand statistical analysis? Okay, now statistical that is asked by Swarnajali Mahajan. Okay, statistical analysis is something statistics is basically what I would like always to say. It's a gimmick to show people that this particular thing is effective. So usually you get to have to get connected with a biostatistician, either in your college or somebody from outside, and discuss with the person regarding your thesis work or dissertation. They will be able to help you out what kind of statistical analysis we need to take. Definitely, I hope the person who will be taking statistical analysis for your will be able to explain more things. But basic, there are a lot of tests called as Z test, T test. The most common one is pair T test, wherein a test, you analyze the person's changes before the treatment and after the treatment. You collect the data, and then you subject that to statistical analysis. That analysis is usually done using a software called as SPSS. So, the statistician will be able to help you with that. And using that SPSS software, we get certain results. Based on that result, we analyze them statistically, and we declare the results, or we come into a conclusion stating that, okay, these are the results obtained. This is how it is statistically significant or not significant. The software's name is SPSS. SPSS. There are a lot of versions. I think the latest one is version 21 or version 20. I'm not very sure, but SPSS is a software. Statistics actually is interesting, but you need to actually put your mind. Exam point of view, important topics in research for UG students. Okay, UG students, the thing is, you can't specifically say this particular thing is just important. Everything is important as far as a student is concerned. So everything can be asked. It's a interesting question though. So you should learn everything, Priya, especially if it is with the UG level. You should learn. But most thing like ethics committee is something that people usually ask. Then what are the different types of research designs that can be asked? Then what is a hypothesis usually can be asked? Then how to formulate a research question can be asked. Anusandhana, like I said, that can be asked. What is the meaning of that? What is the Ayurvedic perspective of research? Those things can be asked. These are the things that comes immediately into my mind right now. There are a lot of other topics as well. So Priya, I think it is better you should learn everything. Were you all able to understand me? Like, it is usually difficult when it is a one-way side of class. In my classes, usually when we take it physically here, it is an interactive session. So if somebody can answer that, it would be good. Oh, at least 11 participants are still there. That's good. Anybody else? Any questions? Dr. Anjana, namukana padakka wind up cheyidalu. Any other questions? Like otherwise, we would like to wind up the session.
We can wind up. Once again, thank you so much, sir.
Okay. Thank you, Dr. Anjana. Thank you. Thank you for being a wonderful host.
Thank you.
Shall I take a leave?